And with Straightsmile Solutions, straightsmilesolutions.com. Let's talk a little bit about tooth trauma and orthodontics. If a patient gets bumped or has some trauma on a tooth, how long until we can either start orthodontic treatment or resume orthodontic treatment if orthodontic treatment has already started? And ultimately, I don't have the answer to that because I'm not an endodontist and I'm not a dental radiologist. And as an orthodontist, I always defer to first the primary care dentist, and secondarily, I have them defer to those people. So I don't make that decision. But ultimately, I just do what they say, because if they tell me I can resume it and something happens, it's not on me. I mean, obviously, if I see something obvious like mobility or if I see a lesion, yeah, I'm not doing it. So, you know, hopefully if it's a start where you're getting ready to start, you already had initial records or you had x-rays from the GP for a baseline. And then if there was trauma, then we're going to take an x-ray at the trauma, after that to see if there's any fracture or anything like that. Orthodontically, I'm going to take it out of occlusion for sure. If it has mobility, it's always a great idea to splint it. If they're in braces, you could use just a heavy wire, just not do any movement, just under tie it and stuff. Just make sure it's out of occlusion. Put some bite bumps on, whatever. If you were already starting ortho. If you were doing Invisalign, you could, or an aligner company, you could block movement on that tooth and the adjacent teeth just to lock it and still move teeth around it. But yeah, I mean, you take an x-ray before, you take an x-ray during, and you at least wait, I would say 2 months, at the very least. Take another x-ray, see if whatever it was has resolved. Make sure there's not, just normal GP stuff. I mean, is there probings? Is there mobility? Is there anything in the x-ray that's shown up after 60, 90 days? And if it's all good after, a couple months, then we can start moving it again. Of course, if there's any concerns, then we defer to our friends, the radiologists, if you take a CBCT to see if there's anything going on if you're not sure, or our friends at the endodontists. So always better to be safe than sorry. Do keep in mind that hopefully you're all getting informed consent signed in your Invisalign informed consent, in your standard braces informed consent. There is a section on traumatized teeth. So whether they had a trauma at age 7, age 10, 5 years ago, it does say that if there was trauma on a tooth and if we move it, funky things can happen. A tooth might die, internal root resorption may happen, external root resorption may happen. So if there was a traumatized tooth, I always want to put that on watch and always want to monitor it every 3 to 4 months. So, whatever you're using, whether you're using pop-ups in your Dentrix or whatever, routinely putting in your schedule that you need to be taking a follow-up PA just to make sure it's all good. And if something happens and it starts heading south, well, then you're going to either have to go to endo and get taken care of, or you're going to have to discontinue treatment. So that is a conversation that you do need to have with all these patients. And that's pretty much it. All right. Thanks so much.